So chest pain is one of the most leading causes of presentation to the emergency department. So as an internal medicine physician, I'm going to give you 5 common causes of chest pain. Number 1, it can be acute coronary syndrome, also known as acute myocardial infarction or heart attack. Not all heart attacks can be seen on the EKG. Sometimes the cardiac enzymes are abnormal. As internists, we'll admit the patient to the observation unit, take a look at their cardiac enzymes, monitor them with subsequent EKGs, and put them on a heart monitor to evaluate their heart rhythm and rate live. Number 2, it could be a pneumonia, which could be viral or bacterial, and often the chest x-ray will show findings of a pneumonia. But the patient will also report things like fevers, chills, coughs, night sweats. They may or may not have phlegm production. They may or may not have sick contacts. In the emergency department where I work at, they'll check you for COVID and flu. Upstairs, we have another respiratory viral panel, which will check for additional viruses. Number 3, it could be a blood clot, also known as a pulmonary embolism. Now, it's not very common for this to be a etiology or cause of your chest pain, but we are seeing it more frequently. And in this, a chest x-ray will often be normal. The blood oxygen levels may or may not be abnormal, but usually you have to perform a CT scan to look at the pulmonary arteries, and that will actually show whether or not there is a blockage. The 4th could be asthma or COPD. Now, asthma or COPD exacerbations don't usually present with chest pain, but they may often have a chest tightness, and their physical exam will show lots of wheezes. It's very hard for them to get air in and out, and you can pick up on that. You usually have to admit them, treat them with inhalers, and we have to give them steroids, usually by mouth or IV, and then inhaled steroids as well. And then finally, we have costochondral or chest pain that's related to a muscle sprain or spasm. Think of someone who's recently been pulling. Sometimes it can be from a lot of stress or pressure. Any of these can cause chest pain, and ultimately your physician will decide which one it is and then go ahead and admit you for the rest of the workup.